morning, everybody.
Good morning.
It's great to be here with you today, and it's wonderful to see some familiar faces here too. And as Sunny said, my name is Blake Wood, and I'm with Texter, and I help coordinate the Together We Will program. And one of the things we want to do this morning is tell you about this great program that IDOH, through its Office of Minority Health, is providing for all different types of organizations across the state of Indiana. So we go to the next slide after that. Well, first of all, with Together We Will, IDOH got some funding from the Centers for Disease Control, the CDC, to allocate to different types of organizations through grants. And so for the next year or so, we're going to be investing over $5 million in different types of community initiatives across Indiana through the Together We Will grant program. And part of the reason for that is because during the COVID-19 pandemic, which we're of course still going through, a lot of different populations in our state, a lot of different regions of our state have of course been affected in different types of ways. And different populations have been affected, whether it be people of color, whether it be rural populations, and other types of groups. And so what IDOH has done is recognize this and seeing that there are different types of areas that need to be addressed through grant funding. But one of the vehicles in order to do this is that there are organizations across our state that should be able to do this and provide assistance to people across Indiana. Next slide, please. We'll have over $5 million to invest in community initiatives. Overall, though, when an organization applies for the program, we'll emphasize that we'll fund grants between $1,000 to $75,000. Like Sunny said a minute ago, we'd like to have $75,000 to start after a year. That's always a nice thing for any type of organization to have. And so our funding range is $1,000 to $75,000. But the types of organizations that are eligible are varied. And first of all, you have to be an organization in Indiana, because it's for Indiana organizations. But our application form, as you can see, has a long list of different types of organizations that are eligible to apply for this type of grant. Whether it's a local health organization, local government agency, as you can see in the first column, whether you're a faith-based institution, a drug-free coalition, you're eligible to apply for Together We Will. Now you'll notice on here with this long list of different types of organizations, most of these organizations probably fall underneath the umbrella of being a nonprofit organization. But what we ask for is that when you apply to the program is that if you are a nonprofit, try to select one of these others that probably best identifies you. So for example, as a nonprofit, you might be a drug-free coalition, or you might be a local coordinating council. And so we ask that we identify, because we keep track of that to see who else is applying for this wonderful program. Go to the next slide now. And through our program, Together We Will has what are called 8 different health priority areas. There's environmental barriers, access, substance use disorder, mental health, COVID-19 vaccine hesitancy, structural and systemic barriers, violence, as well as infant and maternal mortality. So those are different areas within Together We Will that we ask applicants to select one of these areas as their primary priority health area when they apply, and then explain what type of project they'd like to have funded in their application. Next screen, please, Rita. I'll just go through a quick description of each of these areas. The first one we have is for environmental justice. And this refers to different types of things for environmental justice in regard to implementing and enacting upon various types of regulations and laws. But we also have provided on our website also different types of examples of activities for this, which could include things like grocery delivery, distributing transportation, vouchers for healthcare appointments, for example. Also conducting surveys as well. So in our next screen, we have access as one of our areas. And the access refers to broadly as being access to coverage, access to services, access to timeliness as well as access to the healthcare workforce, which is of course very essential here right now, especially during the pandemic and all of its different types of side effects. When an applicant wants to apply in the area of access, we give examples of activities that they can do. For example, may want to expand telehealth services, or they may want to hire and deploy different types of community health workers in their particular region of the state. Or they might want to provide assistance with trying to find healthcare coverage. Many of the residents of Indiana don't have healthcare coverage, or they need help trying to research what healthcare coverage is available. And perhaps a program like Together We Will that our organization does can help them with that. The next screen talks about substance use disorder. Different types of activities that we've been funding for substance use disorder include developing and distributing substance use education information, different types of communities, partnering to provide long-term recovery programming, like a lot of organizations already do across the state, but of course there still needs to be more done in that area. Developing networks for individuals in recovery as well. They have that kind of support for individuals who are going through treatment. As well as some organizations will be conducting surveys for those in the recovery community about different types of things or resources that they might need. The next screen addresses mental health. And different types of activities that we talk about with potential applicants include showcasing community stories about the fluidity of mental health and how that flows, providing mental health first aid, which is something that has been new in recent years, but is definitely essential as we've seen in different types of age groups across the state as a result of the pandemic in terms of dealing with mental health and providing that type of first aid to individuals. We also have funded programs that identify ways to introduce art and music into types of programming that organizations offer as a way of being an avenue for improving mental health and behavioral health. Our next screen addresses COVID-19 vaccine hesitancy. And some of the applicants so far in the program have used that as a priority area to help increase awareness about the vaccines that are available to all Hoosiers. Whether you need to get your first shot, your second shot, your booster, if you need a second booster, different types of brands that are out there, whether it be Pfizer or Moderna or anything else, and different types of vaccines that are available for people that are free to get protection from COVID-19. But in order to help with that, of course, as we've seen during the pandemic, there are different types of conflicting information that we see in the media and among other types of organizations that are out there across the nation. And so funding in this type of area for Together We Will for an organization can take the form of having a town hall meeting to discuss the vaccines, doing marketing for COVID-19 vaccines as well, and also including fact-checking myths, other types of things. I was speaking with a friend last night actually at a dinner, and we were talking about the pandemic. And we found that we had, despite our friendship, had very much opposing point of views about information out there about COVID-19. And in our discussion from the vaccines, and it was not a pleasant conversation that I had with my old friend. I was encouraging him to get vaccinated. He was refusing. I told him that I'd had my first shot, my second shot, I'd had a booster. Now, I'll tell you, when I got my booster shot, that really knocked me down for about half a day or so. The side effect made me really tired and kind of, really lethargic. And those are the kinds of things that he heard about that are keeping him from getting his first shot. But as I assured him, it varies from person to person. But you get the overall protection from the virus, and that protects you. And so that gives you, of course, ease of mind. It protects you, protects your family, protects those around you. And it's important, of course, to get the vaccine. But as I can see from that conversation, there are still pockets out there of different types of individuals, other Hoosiers, who are questioning the need to get a vaccine and questioning even all the facts surrounding the pandemic, which is unfortunate. And hopefully, if your organization happens to take upon a program that helps increase awareness about vaccines, you can address those types of issues. On our next screen, we also talk about something that's been mentioned in some of our other presentations today, structural and systemic barriers. And so, there are different types of barriers that we encounter in public health. And so, through this type of funding for Together We Will, different types of examples for addressing it can include helping to educate providers in systemic issues, whether it be racism, whether it be classism, whether it be other types of bigotry, and also providing different types of training through cultural competency, which is a central issue when it comes to providing the right kind of health care to all Hoosiers today. Structural and systemic barriers can be addressed by providing telehealth services. Often individuals don't have access to transportation to get to a certain appointment to see a certain provider. Telehealth can help transform that by bringing your provider to you online. In addition to that, regarding transportation, an organization can provide transportation vouchers to help people with bus rides, other types of things to get to different types of appointments, other types of events, as well as hiring community health workers who can help with assessing different types of social determinants of health for a person, their family, their neighborhood, and referring them to the resources that they need in order to overcome these different types of health barriers. The next screen, and as you can see it's in red, it talks about violence. Violence, of course, is a pervading issue in any state within our country right now. And so Together We Will can also help in that area with violence. Youth violence, of course, is something that's a primary concern. And so we've had organizations who apply for funding through Together We Will who do youth violence prevention programs and education. They also provide referrals and resources for different types of victims of interpersonal violence as well. And also naming different types of violence and creating different types of awareness campaigns for various forms of violence that do exist. Finally, the 8th area for Together We Will pertains to infant and maternal mortality. There's a few statistics here that have just been recent in the past couple of years. For example, as recently as 2020, Indiana's infant mortality rate was around 6.6%. Now, while that, of course, is a digit in the single numbers, that's still way too high. Being at 6.6%, especially for an industrialized, wealthy nation like the United States. In addition, our state's maternal mortality rate was also a huge concern, with about 80% of pregnancy-associated deaths were estimated to have been preventable. And that's something that's very sobering, and that the Office of Minority Health at IDOH takes very seriously, and looking at those types of statistics and seeing what can be done to make sure those stats go down, and that can hopefully transform Indiana's healthcare landscape into becoming, instead of a state that seems to be falling behind in that, become a state that is leading the way in terms of making sure that infant mortality is low and that maternal mortality is also low. Different types of activities that organizations have been doing with Together We Will in this type of area include home visiting programs, doula support programs. Doula support programs are something that are really emerging in Indiana, Kentucky, Illinois, Michigan, and Ohio. All of our surrounding states have been embarking on those types of programs with educating and supporting doulas in recent years. A breast milk bank is also a great idea. A diaper bank is another great idea to have that available for individuals. Organizing a community baby shower to support and lift up those parents who have recently had children. And also, family planning education is also helpful in this area too. And organizations have really been taking the lead through Together We Will and providing those types of services to their communities. On the next screen, which I can show you here, is how you submit a proposal to this wonderful program. One of the things that we really like about Together We Will is that we don't have a hard and set deadline. We accept applications on a rolling basis. And so we do it online. Unfortunately, we don't take paper applications. Everything is done online at our website. But we accept the applications on a rolling basis at our website at intogetherwewill.com. Applications will be accepted for grant funds ranging from $1,000 up to $75,000. Whenever we first get an application, we take a look to see if it meets our administrative requirements. After that, we pass it to a peer review panel that will score the application, and then it goes through the rest of the process after that. On our next screen, we have some of our proposal components for the application, which includes organization information. An Whenever you apply for a grant, of course, it's always essential that you say who you are. But one of the things we've designed with our application is that we recognize that there are a lot of different organizations in Indiana who may not have applied for grant funding before, or if they have applied for grant funding, especially if it's for a federal grant, they have found the process to be confusing and discouraging. Because a lot of different types of grant programs have a Byzantine myriad of different types of regulations you have to abide by, various types of forms that you have to fill out, and the process itself is very cumbersome. A lot of different federal agencies have recognized that and are trying to streamline their processes in order for organizations to have access to the billions and billions of dollars that are left on the table every year that are not claimed because the grant-making process is flawed overall because it's too confusing for a lot of organizations to figure out. So with Together We Will, we developed an application process that we hope is and is designed to be accessible and user-friendly. And so along with our outline application, the way we've designed it is to make it straightforward in terms of, especially if you're a first-time applicant for a grant, when you look at the Together We Will application, you can see, okay, I need to provide my contact information, I need my organization, our address, telephone number, etc. I also need to identify a priority health area as well. You can also select a secondary priority health area if you apply. It's not required. A lot of our applicants may do a primary health area and pick out one of the other areas as a secondary area of focus as part of their overall project too. We also ask for organizations to describe their current and past experience. What is your experience in this area? What have you done? Or what do you hope to do as well too? And I made a couple notes here on this screen too. In the middle of the screen here, it talks about providing your federal tax ID. Those are some things that we use to identify certain applicants to make sure that you're registered with certain things. So we ask applicants to make sure you provide your federal tax ID, and also, which is also very important too, you provide your Indiana Certificate of Existence. This is a document that comes from the Secretary of State that shows that your organization is in fact registered in Indiana. And so that's something that a lot of state agencies require anyway. We ask for it up front because that helps with the process when you're awarded the grant, it's already there. On the next screen, in terms of what the application calls for, each project has to have a title. So we ask for applicants to provide a project title for us too. We also have a statement of need. And in the statement of need, we ask applicants to say, what's the geographic area of your project? Basically, what cities or counties do you plan on serving with your proposed project here? We also ask that you describe what's called the population of focus. What groups are you going to be helping in particular? And when you do that, the U.S. Census Bureau, through its website, has different types of statistics and demographic information that you can look up. And so we ask applicants if you could provide that too, in terms of providing different types of racial and ethnic breakdowns, socioeconomic breakdowns for your particular area. The Census Bureau's information is usually divvied up by tract, tract and state and county, for example. And so we ask applicants if they go to that website, look up information about your area, and then put that in your application. So that helps our reviewers know what types of conditions exist within that particular geographic area. Next screen. We ask that applicants provide strategies and objectives. Strategies is your overall arching approach to a project that we ask to describe. And an objective then talks about the different types of things you use to carry out a strategy. And so in our application form, we do ask our applicants to make sure that they talk about those, and because that's an area where sometimes they can get tripped up, I suppose. But it's not intended to be complicated for everyone. But with strategies and objectives, we're just mostly asking, how do you intend to approach implementing your project? What's your overall theme here in terms of how you do that. For example, one strategy might be, if you're taking on a certain project, do you have a marketing plan for it for the area? Or do you plan on contacting certain individuals to help you with that as well? Or do you plan on partnering with other organizations to help you carry out your project? That provides that kind of description in terms of how the project will be implemented. Then on our next screen, I know it's a lot, but we try to keep it concise. Every grant application is asked to talk about their activities. And this really gets to the nuts and bolts of the grant too, along with your budget, of course. But when you talk about your grant's activities here, we're asking, tell us what you're actually going to do. Beforehand, you may have told us your strategies and some objectives, but then let's get down to the nuts and bolts and say what activities you're going to be carrying out. Are there going to be some trainings? Will there be a certain event you're going to be putting on as part of your project? Talk about that. Will you be hiring someone to help carry out the grant or undertake this type of activity? Talk about that in your activity section too. Because that then gives us all the details saying, here's our big idea, here's our strategies and objectives, and here's the activities that say what we're exactly going to do in using this grant funds. On our next screen, we have our other proposal components. We have some required templates and documentation. And has anyone out here applied for a grant before, whether federal or state? Sure. And probably when you've done so, you've noticed there are different templates you have to fill out, and there are types of documents you have to fill out. Some of those can sometimes be, very confusing. We've designed a budget template for ours that is in Excel. We try to make sure that it's accessible and user-friendly, but it's for a budget and budget narrative. So we have an Excel template that we use where you can identify on the website using that form what health priority area is that you're looking at, and within that priority area, you can put your budget in there. And then also provide a narrative. And usually the narrative usually matches what your activities are that you've already put in the narrative. But here you're putting, how much does each one of those things cost, for example. And so our grant program funds direct costs, whether it be salaries, benefits, equipment, travel, professional and consulting services as well. We do allow for some indirect services to be funded, which can include things, say, like postage or internet access, if you need that for your project too. So the budget is intended to be a good vehicle for you to input the information that matches your activities of what you want to do for the grant. And also what's helpful too with our budget is it adds the numbers for you in there, so you don't have to worry about when you input an amount, about making sure everything, you're adding it up yourself. It will do that for you whenever you enter your amounts in there. On our next screen, we also ask for you to provide a staffing plan. Usually each project needs a project director or other type of title you want to give that person who's overseeing your proposed project. So we ask that applicants give us a staffing plan saying who's going to be your project director or any other key staff, or who's going to be involved with doing that, and how will that staff function in carrying out the project. We also ask for a timeline, and there's just a Word document that's a template for that. Usually most grants ask for you to provide a timeline, and what we've done is made that streamlined in terms of here's a Word document on a table form where you can list in chronological order the types of activities you're going to be doing. And if you can identify those activities, say if they're a training, if they're a certain event, or if they're a milestone in your overall plan, simply list those and give us a few details about that in chronological order. Finally, for our components, on the last screen, on this screen here, we have letters of support. If you're partnering with another organization for your grant application, and several of our applications do that, they have partners. It's not required, but if you do have partners helping to carry out your proposed project, make sure they provide a letter of support, indicating their support for the project and also outlining their role in the project too, because that's always helpful for our reviewers to see. For example, okay, we have the applicant, you know what they're going to be doing. They have a partner, there's a letter from them reinforcing to us, here's their actual responsibility with the actual project too. And it's noted here too, as you can see on the screen, and this is something that slips up people from the federal level on down. I've noticed, whether it's a federal grant, a state grant, a private foundation grant, often when letters of support are submitted, sometimes they're not signed. And grant reviewers, that's a big headache for them. They always ask, make sure the letter is signed, so we know who it's from, and also make sure it's on an organization's letterhead. That makes a big difference too. If it's on letterhead and it's signed. That's always a key component. And in the past, I've worked with organizations who send in letters and haven't done those simple two things, and they end up not getting funds for it. And it's those kinds of things that really drive a lot of applicants crazy. but we always go out and make sure if you're going to have letters of support, please do it in this type of fashion. The next couple of screens talk about our review process. We have first an administrative review. That's when an application comes in. I'll take a look at it to see if you filled out everything, if you've got all the required components on the application. If not, the good news is the process doesn't end there. If something is missing, I will contact the applicant through email and say, please make sure you provided this, or please make sure you provided that. And that happens sometimes. Sometimes we've gotten applications where an applicant's done all this information, great narrative they have for us, fascinating program, as you read through the narrative, it's wonderful. We get to the budget, and they've accidentally uploaded an empty template without any numbers in it or a narrative in there. And so then at that point, I have to contact them and say, this is a wonderful program, but if you could let us know how much it's going to cost, that's very essential. So then I ask them to please send us your budget for that. Or if there's another type of information like they forgot to fill out a certain field. Sometimes with online applications, this can happen. An applicant will fill out the application, they're moving forward in the application, and they'll come back to something later, so they'll put a notation in there that says fill in later, and they forget to do that. And look at the application, we'll see that, and contact them and say, you forgot one field here, please go ahead and fill that out. Most federal and state programs will kick out an application if you do that. If everything isn't filled out, if everything isn't attached, they'll simply reject it. At Together We Will, we don't do it that way. We give everybody a chance and say if it hasn't been filled out correctly, if you're missing something, we'll contact you and give you that chance to submit that information so that your project has a chance of being funded. And that's something that we're very proud of with this program because that's pretty landmark. Most grant programs in the world don't do things like that. We also, after having an administrative requirement review, we have what's called our merit review. And that's when we have a peer review panel actually score the application. And so they'll go through each application, and each section of the application is a certain number of points, and they score it. The outcome of that then determines whether or not your proposed project and your application will be recommended for funding by the Department of Health, or if not, at least at that point, it can go to technical assistance to get help. On our next screen, it talks about that a little bit more in detail. On our review of applications and our merit review, we use a 100-point scale. And so in order for an application to get funded, an application needs to get at least 70 points after being reviewed. If it doesn't get 70 points, well, if it gets 70 points, it'll go to IDOH to recommend for funding. If it doesn't get 70 points, as you can see here, they get another chance at the process. If it's below 70 points, we send them to our peer technical assistance team. And what that team will do is take the reviewers' comments and their scores, synthesize those, meet with the applicant, go over those, and take steps to help them improve the application with the hope of the applicant resubmitting the application for it to go through the process. The good news here is that we know that process is working. We've had a few applicants so far who submitted applications. They were below 70 points when they were scored. They went through PTAT, that assistance, resubmitted. They've been recommended for funding now. And that's great news to know that that process works and that organizations still have another chance at getting funded. On our next screen, is here as we have talking about our website at IamTogetherWeWill.com, and it talks about more information about our priority health areas. We also have a video on how to apply, which goes to the online application. There's information about different types of things also, whether it be our scoring criteria and point scale is also on the website, showing how many points are given to each area of the application, as well as talking about our technical assistance process, and also, of course, finally, if you get funding, if you're awarded funding, the contracting process, which you do with IDOH in order to develop the contract, sign the contract, and process that. So that, in a nutshell, is kind of how we do Together We Will. I can also distribute to you one of our flyers that we use, which also, of course, has our website's address on there. And one of the highlights, too, on this flyer is that it has some information for Sunny on there, too, because one of Sunny's roles with Together We Will is to, whenever a prospective applicant contacts us, you get to talk with Sunny, which is wonderful. And so she can talk to you about the program and answer some of any other questions as well. Are there any questions?
Who's submitting? Why is everybody's hand not up? Okay.
Video that, so we have proof.
Blake, thank you so much. Appreciate it.
Blake, along with his colleagues, have done a tremendous amount of work really diving into the grant process. Our ultimate goal, in addition to you winning $75,000 to put forth towards your programs and services, is understanding state contracting. And one of the huge milestones in being awarded in the Indiana Together We Will grant is being able to showcase and say you are a state contractor so that you can go after additional funding to continue the process. I'd like to offer that anyone that would, yes, Ms. Hayes.
Question.
Yes.
Can an organization apply for more than one grant at the same time?
Excellent question. You may, depending, as long as they're in different priority areas, and as long as, from the review perspective, there is proof on the submission that there's capacity to execute. So that's all part of the budgetary and also the narrative components. Yes, great question, great question. All right. As this is a collaborative networking, I would highly recommend that you have a connection point to Mr. Wood at some point in time during today. And then I'd like to acknowledge our exhibitors again that are here today for the second day. Thank you so much. And I'd like to, woohoo! And then I'd like to invite Don Ganier here from QSource to give us just a quick insight into some of the initiatives that QSource is doing around the state.
Thank you, Sunny. Hello, I'm Don Ganier with QSource. It's been fun to be here with you these 2 days. I really have two main things I want to get out to you. Share some information about QSource and then two asks for you. QSource is a federal contractor. We do other things, but in the state of Indiana, we're contracted by the Centers for Medicare and Medicaid Services, mostly Medicare, to do healthcare quality improvement. In that we do kind of two main areas. One, we work directly with nursing homes on doing quality improvement inside those nursing homes. Have worked extensively with them on COVID and infection control. The second thing is we work with community health coalitions, and I've got a map up here of the different coalition areas, or we've changed our language on it. It's called Partnerships for Community Health now. The different areas that we're working in, there's 12 of them up there. I'm guessing most everyone is working in at least one of those areas. And the ask I have for you there, so I'll tell you a little bit about them first. We try to get healthcare providers, community service providers together to work collaboratively. If there's more than one healthcare provider or healthcare system in a community, we try to get them to work together, not competitively, but together on improving the quality of healthcare for the patients in those regions. In a few different areas. The first is on care coordination, so reducing hospital readmissions. The next area is chronic disease. The next area is opioid, trying to reduce the number of deaths due to opioid overdose. And then the last area is on immunizations, which now includes COVID, but also flu and pneumonia. The way we do that is we have regular meetings, either monthly or quarterly, just depending on the community, and they're locally led. My ask from you is I want you to be a voice at those tables. to join those meetings. If you're working in one of these regions, we're trying to achieve healthcare outcomes, and the best way to improve or to make sure that we're talking about health equity in those and we achieve equitable outcomes is that we have a diverse set of voices at those tables. And that's an area where we don't have enough in any of these regions. So I want you to be part of those, and it's an open invitation. I've got a QR code. You can find some of the resources that we share with our communities, but also some information about how to join those communities, and welcome to come and talk to me. So that's my first ask. The second thing is that in our contracting with Medicare, like many others, they recognize through COVID that health equity is a huge problem, and they're trying to do more about it. And they've asked us to do some efforts on that. As a result, one of the things we're doing is trying to encourage organizations to work on what we call CLAS, culturally and linguistically appropriate services, and we're sharing the standards that are shared through the Office of Minority Health, called Think Cultural Health. We're trying to get organizations to look at those, do some self-assessments, do some internal changing. We're guiding them through that process. Now, I don't think that necessarily the people in this room are the target audience for that, but I think you have a lot of resources and information that if you are providing that type of training, we'd like to highlight your organization, share some of the things that you're doing so that we can encourage other organizations to take advantage of that. So that's my second ask of those here. All right. Again, there's a QR code. It goes to our website, kind of actually links directly to a lot of the resources we have. If you want to use any of those resources, they're free to use. So go ahead and do that. Are there any questions? All right. Sonny, thank you for the chance to talk.